All right, guys. So I'm just going to pick up exactly where we left off in class, which is in chapter 14 with leukocyte phagocytosis. So we kind of already talked a little bit about the concept of phagocytosis, and this is the process by which the leukocytes or the white blood cells are going to engulf and digest the microorganisms. So this is a little step-by-step picture of phagocytosis. So we have the first step where the bacteria becomes attached to the membrane invaginations called pseudopodia. Okay, the bacterium is then ingested, forming a phagosome. Okay, so it has this little membrane around it. Okay, and then the phagosome, the phagosome fuses with the lysosome. Okay, and then the lysosomal enzymes digest the captured material, and then digestion products are released from the cell. So goes through all of those different phases and then is released from the cell. Okay, so inflammation and the inflammatory response. And we know that inflammation is the body's protective response to pathogens, foreign bodies, or an injury. So the body focuses host defense components at the site of an infection to eliminate the microorganisms and heal the damaged tissue. And the major events in the inflammatory response, so we have the tissue is invaded by bacteria, results in injury to the body. And then the reaction is the body's going to increase blood flow, and which delivers the body's defense cells and plasma to the invasion site. Okay, so that's why we're going to have redness, heat, usually at a site of inflammation because of the increased blood flow. So the leukocytes and plasma proteins leak from the blood vessel into the tissue at the site of the infection. Leukocytes fight the invading bacteria, and some tissue destruction occurs in the area surrounding the infection site. That is the site, it's a site effect of the body's inflammatory response. So even in a normal injury, it is common to see some of the body's own tissue be destroyed by the immune system. So it's not only in periodontal disease that we see that. So this is just showing like a nail through the epithelium. Okay, we can see like the reed pegs here with the underlying connective tissue. Okay, so tissue damage triggers a local increase in blood flow and capillary permeability, okay, because that's how the body is going to bring the inflammatory mediators to the site of infection. And then the second step is the permeable capillaries allow an influx of fluid or exudate and cells into the tissue. So exudate is always a sign of infection, but it's also a sign that the body is fighting that infection. And then the third step is the phagocytes migrate to the site of inflammation, which is called chemotaxis. And then we see the phagocytes destroy the bacteria after that, okay? And that's like the same exact image that we saw just a couple slides ago. Okay, so the inflammatory biochemical mediators, so biologically active compounds secreted by the cell that activate the body's inflammatory response. The mediators of importance in periodontitis are going to be the cytokines, prostaglandins, and the matrix metalloproteinases. And we're just going to call the last one MMPs. They're always going to be referred to as MMPs. So cytokines, prostaglandins, MMPs, really important to know that those are going to be our inflammatory mediators. That we're going to see an increase in the bloodstream in an active perio patient. Okay, cytokines, prostaglandins, MMPs. Okay, so the cytokines are the leukocytes secrete the cytokines that play a major role in regulating the behavior of the immune cells. Okay, and the chemokines are a subgroup of cytokines, and those cause an additional immune cells to be attracted to the site of infection or injury. And the more immune cells we have, the goal is that the more bacteria is able to be pulled away from the site of infection. Okay, so we have our two stages of inflammation. We know acute inflammation and chronic inflammation. So the difference, acute inflammation, we know is a short-term normal process that protects and heals the body. The acute inflammation process is achieved by the increased movement of plasma and leukocytes from the blood into the injured tissue. Okay, the 5 classic signs of acute inflammation are heat, redness, swelling, pain, and loss of function. So like we were talking about earlier, a localized rise in temperature due to an increased amount of blood at the site, okay? The body's trying to bring more blood so that it can basically bring away the bacteria more quickly, okay? Because all of these inflammatory mediators are released from the bloodstream. So then next we're going to see redness, okay, the result of also increased bloodstream to the area of infection. And then we'll see swelling, which is going to be the result of the accumulation of plasma and leukocytes at the site. You'll typically also see pain. Excess fluid in the tissue puts pressure on sensitive nerve endings, causing pain. And then loss of function, the result of swelling and pain. So for example, inflammation of a finger would cause you to favor that finger and not use it in a normal manner. If you smash in a car door or something like that. So the acute inflammatory response is going to be blood vessels near the infected site become more permeable. The PMNs are the first cells to arrive to the site, and they are going to release our cytokines, okay? So the liver produces a C-reactive protein, or CRP, and if the body succeeds in eliminating all the microorganisms, the tissue will heal and the inflammation will cease, okay? So homeostasis, the goal at this stage of the inflammatory process is to establish homeostasis. So this is the process of the body's tissue maintaining its optimal state of being. And immune cells leave the area, tissue structures return to normal, and the blood flow is reduced with no damage to the bodily tissues. Okay. And then the resolution process, this uses the cells to provide stop signals that lead to the shutdown and clearance of the immune cells. So basically, this is just so that the immune cells don't continue to work after the infection has already been cleared. Okay. Once this is accomplished, the body actively shuts down the inflammatory response to limit the damage to the host. And then the shutdown process prevents progression of inflammation from acute to chronic. So in health, reaching that homeostasis point, if the immune system is functioning properly, it knows when to shut off, okay? Periodontal disease, we know that these diseases are characterized by the dysfunction of the resolution pathway that shut down the inflammatory process. So the result of failure of periodontal tissues to heal in a chronic, progressive, and destructive, non-resolving inflammation. So basically, the body can't recognize that the infection has been taken care of, or it can't properly take care of the infection because it cannot physically remove all of the bacteria because they're multiplying so quickly, especially at the base of a pocket near the junctional epithelium. So it just continues to try to clear the infection, and it's working, it's creating exudate to try to clear, and it's bringing more leukocytes, more bloodstream, and that's why we're getting more inflammation. The patient may notice that there's more bleeding when they brush and floss, if they're brushing and flossing, but that's really the only thing that they're going to notice. Okay, and then in our chronic inflammation cases, we know that this is a long-lived, out-of-control inflammatory response that continues for more than a few weeks. It is a pathologic condition that can destroy healthy tissue and cause more damage than the original problem. Okay, the classic warning signs seen in acute inflammation are usually absent in chronic inflammation. The problem may go unnoticed by the host or the patient. Clinically, pain is often absent. So we've talked about this a lot. Perio doesn't typically hurt, even though the tissues are being destroyed in really a similar way as caries, right? Because the caries bacteria is basically eating away at the tooth structure, but the tooth is innervated, where our periodontal tissues, like the alveolar bone, does not have any nerve innervation. So it doesn't hurt when the bacteria and the host immune response is destroying it. Most commonly, we will find macrophages in chronic inflammation, okay? Chronic inflammation occurs because the body is unable to rid itself of the invading organism. The invading microorganisms are persistent and stimulate an exaggerated immune response. When inflammation becomes chronic, the inflammatory response can become so intense that it does permanent damage to the bodily tissues, okay, like in chronic perio. Chronic inflammation is an out of control response that can destroy healthy tissues and cause more damage than the original problem, okay? Chronic inflammation is characterized by an accumulation of macrophages. Okay, that's really important to understand that macrophages are those are our first responders, right? That we're going to see. These are longer lived cells, okay? So, these ones are going to be the second ones to the site, right? The PMNs are typically going to be the first. Macrophages engulf and digest the microorganisms, okay? And these are the ones that have a longer life. And that's why we're going to see them in chronic inflammatory process, okay? Leukocytes release inflammatory mediators that perpetuate the inflammatory response. So examples of chronic inflammation, we have rheumatoid arthritis, diabetes, asthma, gingivitis, periodontitis, and atherosclerosis. So all of these conditions, guys, are really challenging to manage and really depend on a lot, on the host's total immune response, okay? B, in patient compliance, okay? It's huge that, like with diabetes, that patients are managing their diet and their exercise, they're tracking their A1C and their daily sugars, okay? Same thing with perio, that they're having frequent recalls with a dentist or periodontist, having those 3-month cleanings. They're using an electric toothbrush, flossing, using proxy brushes, whatever the best OHC is for that patient. Really, their compliance relies on keeping the bacteria at bay so that their body's not having to do the entire thing by themselves. Okay, periods of remission or exacerbation. We've talked about this a lot. Signs and symptoms of chronic inflammation may partially or completely disappear during a period of remission. The signs and symptoms may reoccur in all of their severity in an active period of disease known as exacerbation. So this is really important when you're doing OHI with your patients of, why do I need to come 4 times a year if everything's looking good? And it's like, yeah, everything's looking good, but let's talk after everything looks good for 2 years or more. And then really, if a patient has had extensive perio treatment, multiple perio surgeries in their life, I really don't think that that person should be extended past a 4-month recare, just because, perio is cyclic. And if something happens in their life and their stress levels go up and we tip that balance again, where their body can't keep up, they go from being in a long period of remission to another period of exacerbation, okay? And we don't want them to be unsupervised in that state, okay? So here's just a photo of the cells and mediators in chronic inflammation, okay? So we see the macrophages, and we see the interleukin-1, interleukin-6, and the TNF-alpha, okay? We see our chemokines, our prostaglandins, okay? Okay, so our inflammatory chemical mediators. So the chemical mediators are biologically active compounds secreted by the cells that activate the body's immune response. Important mediators include interleukin-1, 6, and 8, okay? That's really important to understand that you can pick those 3 out of a list for perio, okay? Those are our inflammatory chemical mediators, okay? Interleukin-1, interleukin-6, and interleukin-8. Leukotrienes, okay? Prostaglandins, and TNF-alpha, okay? Being able to understand that those are going to be our mediators. We have the 3 interleukins, the leukotrienes, and prostaglandins, and TNF-alpha, okay? So that's all done for chapter 14. Remember, if you weren't in class, guys, you need to finish the chapter 13 and beginning of chapter 14 slides on your own. Of course, if you have any questions when you're reviewing that, please let me know. And we will move on to chapter 15.